Hello everybody, welcome to the next episode. Today I'm going to be going over bruxism. What is bruxism? Bruxism, what it is when you grind your teeth. And this can be caused by a lot of different things. One of the most common ones is stress. So if you have a person that's very stressful, what happens is that there are people that when they get stressed out, they tend to grind their teeth, and they kind of do it out of habit. The other thing that can happen too is you can grind your teeth when you're sleeping, and in most cases that's mostly when it happens and you don't even realize it's happening. So a lot of times you'll go to the dentist, and the dentist, when they take your x-rays, there are certain signs in your teeth, especially wear and tear, which is the most common thing, that will cause a dentist to tell the patient, you have bruxism, you grind your teeth. And a lot of times I get patients that tell me, no, I don't grind my teeth, and then I have to show them and explain to them what is, why it's happening and how it's happening. Now, while there are not a lot of pain that you can get with bruxism when you grind your teeth, but there are a lot of symptoms that you can get later. One of the common things that you normally get in the beginning, if you do grind your teeth very, very hard, is you'll start getting jaw pains, or TMJ. And now, while those are the most common things, there's not the only thing that can cause the grinding of teeth. That can cause bruxism. Another thing that can cause bruxism, which is very common, is if you're a person where your teeth are not aligned. So if your teeth are if they're crunched together, if they're separated apart, and it's hindering the way you bite, when you chew and stuff like that. What happens in those situations is, because of the way they're not impacting in the adequate way that they're supposed to, and your mouth can't adjust for the position that the teeth are in. So what happens is that while you're not grinding your teeth, they are impacting, and they're, with time, especially your front teeth, because your front teeth are not designed for chewing, they're designed for cutting. So normally, like when you bite an apple, when you eat something, you tend to cut it with the front of your teeth, and then you unknowingly will the food moves back, and you start chewing on it with your molars. That's why your molars are so big as opposed to your front teeth, and why your front teeth are sharp as opposed to your molars. So when that happens, again, you'll have a loss of teeth. Your teeth start to grind down, they start to chip away, and eventually, as time progresses, and you keep grinding down your teeth, or the teeth keep chipping, there's gonna be a breaking point where they just can't take the pressure anymore, and they'll start to crack, and then they'll start to break down, and then at that point, you'll go to the dentist, and you might have pain. They'll tell you that you might need a root canal because the tooth has just been worn down too much, or it's just broken. It's at the root now. So what are ways to prevent bruxism or have it go away? There are times, if your teeth are crowded, or if they're spaced out. Normally, if you get an orthodontic treatment, if you get an alignment of some sort, in most occasions that will fix your bruxism. If you're a person that you, out of habit, during sleeping, grind your teeth, and your teeth are aligned, and you don't have that issue, then there are things like a night guard, where you put it in your mouth when you go to sleep, and what happens is that it won't prevent your grinding, but instead of you grinding against your teeth, which are two hard surfaces that are just grinding against each other, you're going to be grinding against a soft rubber, and the pressure you put on the rubber instead of your teeth, it's gonna, for the longevity, is gonna prevent you from continuously grinding your teeth. Those are primarily two major things that help with bruxism. If in the event that you might also have a situation with your jaw, if your jawbone is not, maybe you were born with a deformity of some sort, or where it does affect your jawbone structure, and neither one of them work for you, then you might have to see a specialist, a maxillofacialist, and maybe you might have to get a surgery done to fix the issue, which will prevent the bruxism later in the future. Well, it is something that is not as common as other things like cavities and periodontal disease and so on and so forth. We do get a good amount of patients that do have bruxism, and a lot of them don't know. And again, the only way we can tell is by looking at the patient's x-rays. So if you believe that you have it, if you when you wake up in the morning, if you feel jaw pain, you should talk to your dentist and inform your dentist, and then he can check your teeth to see if maybe you do have bruxism, if you are grinding your teeth, and you can take care of it sooner. If you're a person that doesn't go to the dentist that often, and then you notice that your teeth might start breaking and cracking, and you're not really sure why, it could be that you might have bruxism. So make sure you ask your dentist if you have bruxism, or if you notice that your teeth are wearing down and there's a lot of wear, then you more than likely do have bruxism. You do more than likely grind your teeth. And then talk to your dentist and get that taken care of, because you don't want it to get worse. You want to be able to handle the situation as soon as possible, because what happens is that as you start grinding your teeth, then you're more than likely not going to like the look of your teeth, and then you have to get things like veneers, which I'm going to go over in a later episode, or even crowns to try and take care of all that area, especially in the front, because everybody really cares about the front of their teeth. You really want the front to look very beautiful, but you also want to take care of the back of your teeth. Okay, so that's going to be it for today. The next thing I'm going to go over in the next episode is going to be whitening and how it helps and how can you keep it for the longevity for a very long time without having to maybe need a reapplication in the future. Okay, so as always, flourish and prosper, and thank you.